What are those years of antibiotics doing? What about years of taking antacids or proton pump inhibitors, right? Or just overall medications. Every single medication you accumulate over the year is making you sicker and sicker with an absence of symptoms, which is very, very, very concerning. And if it's not, it should be very, very, very concerning. All right, everybody, welcome to another episode of the Jacque Show. Today, we're going to be talking about a topic that, quite honestly, I feel silly talking about because I know what everyone on Instagram and TikTok and everyone's going to say. Doc, you are a guy talking about menopause, right? I'm not a woman. I don't have female hormones. So what do I know? Why would I be speaking about this? Well, the reason that I'm speaking about this is because I have to speak about this. The way that women are being treated in the world is embarrassing at this point. And, you know, we have this slide towards anybody can be anything that they want, but physiologically speaking, normal things happen to a female's body, and menopause is one of those. It is a normal phenomenon that happens. It's a normal health event that happens. And what happened was at some point, menopause started producing symptoms. Okay, and now when we think about menopause, we think about hot flashes, hair falling out, vaginal dryness, decrease in sex drive. And we think that menopause is this disease state that we hit or that females hit when they hit a certain age. And it doesn't have to be that way. And I think I should probably reiterate that. It does not have to be that way. And so when we're sitting here and we're seeing females time after time after time just get chucked into menopause, symptoms are horrible, relationships fall apart, their identity falls apart, and they feel like they don't know who they are anymore. They're having trouble falling asleep, they're gaining weight, and it's just one thing after another after another. So menopause, it is a normal thing to occur. It is abnormal, however, to have these drastic symptoms that are associated with menopause. And if you have these symptoms, it's because you waited till menopause to address them. So my advice to any woman out there who's listening to this, if you're 30, 40, however old you are, I would go all the way back to when you got your first menstrual cycle, when you hit puberty, you should be working on your hormones. You should be working on your adrenals. This is a huge piece of menopause, not just the hormonal aspect of it, but the adrenal aspect. There's an intimate connection with the neuroendocrine system between the adrenals and your gonadal system, your sex hormones. So let's dive into this here. So now the average age that most women average, right? So we can have outliers above, outliers below. The average age that people hit or females hit menopause is going to be about 51 years old, 50, 51. Okay, it's kind of like the normal thing. Sometimes slide in sooner. Now, when we have menopause symptoms that do happen, again, it's a sign that your hormones have been out of whack and out of balance for a while. It's where these women will come to me and they're like, hey, I'm 35, I'm 40, I think I might be perimenopausal. I'm having all these weird hormonal symptoms. My cycles aren't regular. I've got breast tenderness. I've got these rashes going on. What is it that my hair is falling out? And to those women, it may not be the fact that you're menopausal or premenopausal or perimenopausal. It's the fact that you've had years and years and years of compounding stress that has just continuously deteriorated those systems, right? And with the American hustle nowadays, women are being told that you're basically a failure unless you've got like 48 jobs and unless you're earning 10 figures a month. That's kind of like your job. That's what you're supposed to do now. Oh, and by the way, make sure your husband's happy, make sure the house is good, make sure the kids are good. Here's more on your plate. Stressful just hearing me talk about it. That's why I giggle. I'm like, you kidding me? That's a lot of stress. But that's one of the most overlooked things whenever it comes to menopause, the stress response. If you've ignored your hormones this entire time, your menopausal, slide, if you will, is typically going to be pretty problemsome. Or if you've had, hormonal irregularities, PMS, infertility issues your whole life, going into menopause is probably going to be hell for you. So you need to make sure that you're prepping yourself, prepping your body to go into menopause. So it's a slow transition, because once you're in it, man, you should be enjoying this. It should be so beautiful. It should be so amazing that you made it there. Menopause means you're no longer bleeding each month. You don't have to worry about hormonal fluctuations. You have more steady state mood. You're supposed to have more energy. You can have more of a sex drive, because there's different hormones that go down, and then there's hormones that kind of stay, relatively normal. And when we have these hormonal fluctuations and we have these dropouts of our hormones, progesterone, estrogen, that's typically when we're going to get these symptoms, okay? The other thing that's really important to know is there's a difference between hot flashes and stress flashes. I almost stuttered over saying that. Hot flashes versus stress flashes. Stress flashes. It's hard to say. And what I mean by that is, women will be going about their day, and they'll be put into a stressful scenario, and say they're 49 years old, and all of a sudden, boom, they're told to speak in front of 100 people. They start sweating. They're like, "Doc, I think I have hot flashes. I'm getting hot flashes now. I've never had them before. I don't really know what's going on." I'm like, "Well, you went into a stressful event and you sweat from that." Or you're in a horrible relationship, and every time you go home to your spouse, you're stressed out, so you start having hot flashes. Or you're starting to go to bed and you're rewinding the wheel of all the things that you haven't done in that day, all the things you have to do the next day, and you can't sleep, your cortisol spikes, and you get hot flashes or night sweats, right? There's a difference between hot flashes and stress flashes. And stress will cause a hormonal imbalance, which can cause hot flashes, right? So it usually starts, you have your stress flashes, and then hot flashes are going to be soon to follow, okay? Because that stress response is going to drain you. So we have to make sure that you're also sleeping properly. And that's not just, hey, I get 8 hours of sleep. I'm talking about in bed, asleep by 10 o'clock, waking up by about 6 o'clock in the morning, getting out and about your day. That's going to be the best way for success, to make sure your adrenals are good, your insulin's good, your body's good, your energy's good, and you're not craving sweets throughout the day, okay? Weight gain, okay, is also not a normal part of menopause. Okay, weight gain is not a normal part of menopause. Now, what can happen? I'm going to use my hands here. So if you're watching me, you'll see it. If you're not watching me, then I'll try to do my best to explain it. Okay, so you have your progesterone. Progesterone, I'm just going to say, is high right now. Okay, high line of progesterone. And what happens is progesterone is what makes you have your cycle. And as the years go by, your progesterone drops down until you no longer have any progesterone left over. As you were in your cyclical years, if you had high estrogen and you had some estrogen dominance, right? Your estrogen is supposed to come down with your progesterone as well. But if your progesterone goes down and it bottoms out and you still have estrogen, you're going to have weight gain. You're going to have hot flashes. You're going to have higher risks for cancers, because estrogen needs to come down. A lot of cancers are estrogen receptor positive, which means they kind of feed as a fuel off of estrogen. So again, making sure your hormones have been mapped out and been addressed before you ever even come close to menopause is going to be your best way to smoothly sail into a menopausal state, okay? Now, menopause, what are the hormones doing? So there's some important hormones. We just talked about progesterone. Progesterone is basically going to take an all-time low since you were prepubescent. Okay, so it's basically boom, dropping down. Estrogen, again, is going to come down too. Luteinizing hormone is going to come down. Follicle stimulating, come down. GnRH is going to come down. So everything's basically trending downward. The only one that relatively maintains the same, it doesn't have a postmenopausal range for women, is going to be your testosterone. This is something super easy, super Googleable or DuckDuckGoable, where you can plug it in and say, what do my hormones do in menopause? Boop. You're going to get this beautiful graph and see what's happening with your trend lines there. When we have the typical symptoms of menopause, right? Symptoms of a disorder of menopause, they should really call it something else besides menopause, like menopauseitis or something like that. Because menopause is natural, it's normal, it's not normal to have symptoms. When we do have these symptoms, it should be called something else. It should actually be a disorder, a hormonal imbalancing going into menopause. Why I haven't patented a name for that, I really don't know. Anyways, so all of these symptoms that you can and will experience is going to be due to hormonal fluctuation, okay, where hormones kind of drop down, okay? Now, there is a time where your estrogen can stay high, And again, you can have those risks that I just talked about, or you can have an issue where your estrogen goes too low. Okay, if your estrogen goes too low, one of the things that people don't know about estrogen is really important for bone health. So you can actually develop osteopenia, you can develop osteoporosis, you can have bone fractures, you can fall and break your hip and boom, you don't recover because your estrogen was too low. You can have your dry, achy joints, right? So if your estrogen is too low in menopause, you're going to be at a higher risk for a lot of other diseases and disorders, right? So it's all about this balance. You don't want to be too high, too low. You have like this sweet spot of where you want to be in order for you to enjoy menopause the way that you're supposed to. There's a very easy way to do this, and I'm going to go through it. When we go into this, for the most part, when you are premenopausal, you have your sex hormones being produced from your sexual glands, if you will, your gonadal system, okay? When we cruise into menopause, a lot of our production is actually going to shift from our adrenal glands, because our adrenal glands are going to make a lot of the precursors to our estrogens, to our progesterones, to our testosterone. Okay, so when this happens, if we don't have proper adrenal function, then menopause is going to be hell. Signs that your adrenals are horrible. 1, hormonal imbalances. 2, no energy throughout the day. 3, weight gain. 4, thyroid conditions, whether it's hypo or hyperthyroid. 5, brain fog. 6, gut issues, right? We just keep compounding these things. And what gets silly, but also kind of cool at the same time, is no matter what your symptoms are, no matter what your diagnosis is, whatever it is, it's typically going to stem back from the same causes, right? Causes. Is there something wrong with the adrenals? Something wrong with the gut? Something wrong with the hormones? Okay. Now, if there is something wrong with that, we can extrapolate further. This is where the functional side of things come in. What are you doing in your lifestyle? Are you working too much? Working too many jobs? Have a horrible relationship? Do you have financial stress? Are you exercising? Are you exercising too much, too little? Are you putting horrible food in your body? Are you not eating at all because you're working too hard? The diet and lifestyle factors contribute to about 95% of chronic disease out there. They contribute to 95% of cancers, and the other 5% are genetics that also get expressed from poor diet and lifestyle, right? So again, whether we're talking about menopause or whether we're talking about a headache that you got last week and you're 25 years old, the causes are typically going to be categorized in the same cause and effect, if you will. And then as the symptoms go unchecked for a long period of time, more diseases do take place. Now, when we have this stuff and we have adrenal issues and we have gut issues, the common place that people will go is going to be to your medical doctor, to your endocrinologist, to your ologist. And I was just doing an Instagram live the other day, and I'm like, if you go to an ologist, your ologist is an idiot. Right? Your urologist is an idiot. Your gastroenterologist is an idiot. Your endocrinologist is an idiot. Your oncologist is an idiot. Why? You cannot break down the body into just one system. You cannot do it. If you do, you will never, ever, 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 ever be successful at correcting the system that you are supposedly an expert in. It's impossible, right? The body is one. Mind, body, spirit is one. There's no divisions between the two. If I hit my toe, the rest of my body is going to be affected, right? If I have a gut infection, the rest of my body is affected, right? Think about this stomach bug that's going around, the norovirus. Everyone's getting it. What's happening? They're having horrible symptoms. They're having fevers. They're having all kinds of digestive discomfort. They feel like crap. They're tired. They're lethargic. Did that stomach bug just hit the gut? Right? No. And if you went and you had high blood pressure, but you had the norovirus and you went to your cardiologist is going to say, oh, you have high blood pressure. Take this blood pressure medication. Let's bring it down. But I have this norovirus. I have this stomach bug. What are you talking about? Right? So these ologists are very good at very little. And it makes them very not good at actually helping you. It's going to be a whole different podcast of the ologists and how they're idiots. And I'm just going to keep saying that until I get yelled at, and I'm just going to keep saying it some more. So moving on past that, the main organ systems that are going to be contributing to these types of symptoms, these types of disorders of the hormonal system is still going to come down to the neuroendocrine, so the adrenals connection with the hormones, the GI system, and the detoxification pathways. Okay, we already talked about the adrenals, and we have the HPA axis, that's the adrenal axis that's connected to the gonadal, HPG axis, which is connected to the HPT axis, so thyroid. So all these things are kind of intimately connected here. And when you have a deficiency in one, it's going to impact the others. That's why they say, if you have a thyroid condition, you're not supposed to take medication until your adrenals are corrected. Synthroid, the number one medication, levothyroxine, number one medication for thyroid, says it right on the insert. Nobody listens to it, and your doctors don't test it. Or if they do a simple blood cortisol test, which is the dumbest, most inaccurate test that you can do for your adrenals. Okay, you at least need a 4-point cortisol, but I like to do more than that because I'm excessive. I like to see your cortisol awakening response, right? See what your adrenals are doing first thing in the morning. It tells me if your HPA axis is broken or not, okay? So anyways, neuroendocrine, intimately connected here. GI system is one of the other ones that is very, 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 very commonly overlooked as well because, right, you're told to go get a colonoscopy, right? Get a colonoscopy to see if you've got polyps in there or see if you have inflammation to the bowels. If you do have polyps or if you do have inflammation of the bowels, number one, where the hell was your doctor the entire time that you were going to them in helping you to prevent these types of things from occurring, right? So they already failed on that account. Then you have polyps, and then what do? Now you go to another urologist, you go to an oncologist, right? You either get the polyps removed or you do some cancer marker testing, you do chemo, you do some radiation, you get plugged and chugged into drugs and surgery again. Okay, or if you do go to a gastroenterologist, they're like, well, let's just run a panel, a simple panel with just a couple of infections in there. They never once look at the microbiome. They don't look at how your stomach acid is doing. They don't look at the cause of your acid reflux. They just are looking to treat with drugs or surgery. 100% of the time, every time, right? Was it Sex Panther? 60% of the time, every time. I don't think that makes sense. I know my buddy Johnny will correct me on that, but it's something like that. Either way, what they're missing is what is the microbiome doing, right? What are those years of antibiotics doing? What about years of taking antacids or proton pump inhibitors, right? Or just overall medications that are causing a deprivation of certain vitamins and minerals within the body. Every single medication you accumulate over the year is making you sicker and sicker with an absence of symptoms, which is very, very, very concerning. And if it's not, it should be very, very, very concerning. Okay, it's not getting to the root cause of the problem. It's only covering up symptoms and making your body shut up. It's like putting a gag over you, like, don't say anything. But I'm on fire. Yeah, but don't say anything. Okay, stop telling, right? That's what your body's being told to do. Just shut up and just keep pushing through because we have stuff that we need to do. So your body deteriorates and we hit menopause here. Ladies, you go through menopause, you're like, this is horrible. This sucks. Right? I know a whole bunch of people who there's like, I call them like the Dr. Kevorkian of hysterectomies, right? And they're like, well, I was told that as soon as I hit menopause, I'm going to gain weight. I'm like, no, that's not true. And they're like, well, they say that if I get my uterus and everything taken out, if I get a full hysterectomy, then that won't happen to me. I'm like, well, if you get that whole thing taken out, then we're talking about testing you repeatedly, making sure that you're on some sort of bioidentical support to get your hormones back on track, or just work with the adrenals to make sure that your adrenals are given enough precursors for those particular hormones, right? But I can typically know if we test before you hit menopause, I'll know what your adrenals are doing and how that's going to impact your sex hormones. Right? Again, this is the difference between going traditional or going towards a functional doctor like myself. Okay, so these types of symptoms, they are not normal. These symptoms are not normal for menopause. It's just something that people suffer with because they have neglected their hormones their entire life. They've neglected their body their entire life. So what do you do? How do you correct this? How do you prevent this? Number one, get properly tested. Don't just fall for the gimmicky supplements that somebody's trying to tell you, because Instagram knows how old you are. So as soon as you start getting into those premenopausal or perimenopausal ages, you're going to get marketed to for menopausal support, hormone support. Just take this, just take that, just take this, just take that. Find that underlying cause, right? Why is your progesterone low? It's because you have a gut infection? Is it because you have a poor adrenal health? Is it because you feel like you're getting attacked by a bear every night because you and your husband don't get along? What is it? What else do you do? Make sure that you correct the adrenals, correct the gut. Make sure that if you are on any medications, you know what that's also doing to you, right? A lot of people will get put on SSRIs going into menopause. I think that's one of the worst things that you can do. SSRIs have a history, if you look up the research, they have a history of converting your testosterone into estrogen. Okay, which in turn, think about an estrogen dominant person. That means you're going to gain weight, you're going to be emotional, and it's going to push an increased risk of cancer if your body cannot metabolize and get rid of that excess estrogen that you're converting from your testosterone. On top of that, your sex drive is going to go down. Your energy is going to go down. You're going to have worse symptoms of quote unquote menopause. I'm just going to call it menopauseitis because it's not menopause. You're going to have worse symptoms of menopauseitis as you're going into menopause, right? So your medications can also be pushing you into a much worse symptom-based menopause, calling it menopauseitis. So make sure you do an inventory check. Make sure that if you are taking medications, you know what they're doing to your body. And I'm not saying if you have a high blood pressure medication, know that it's going to bring your blood pressure down. That's not what I'm saying. I'm saying learn how it works in the body, learn how it interacts in your body. It slows your heart down. One of the number one side effects of blood pressure medication is fatigue. So if you have fatigue, what do you think that's then doing to your adrenal glands? It's slowing them down. You cannot have fatigue if you have proper cortisol production. When you need it, you would have energy. So that means your blood pressure medication is trying to suppress your adrenals, which is dangerous because if you suppress your adrenals work with your salt, your sodium, potassium pathways. Okay, there's a whole system. I won't go into it, but it basically regulates your fluid levels in the body. You can have edema. You can have an increased risk of heart disease, heart attacks, strokes, right? You can have orthostatic hypotension. And if you're affecting your adrenals, remember your adrenals are then going to impact your sex hormones, right? So then you're going to have a decrease in your sex hormones because you're stressed out and your body's trying to give you more cortisol, even though you're synthetically suppressing it, right? And then your brain health is going to go down. You're going to feel like you're constantly burnt out. You're going to be susceptible to more infections. You're going to have decrease in stomach acid concentration. You're going to have poor gut health. And you're just accumulating all these symptoms. And this is just basic physiology coming from one medication, one of the most common medications, blood pressure. Okay, so know this stuff. SSRIs increase your conversion to estrogen. Not good. Not good for anybody. So know what your medications are doing for you. You can go to mitavin.com as well. I've done a video on it before. Or you can go to drugs.com. This is always enjoyable. And you put in the drug interaction checker. Put in all the medications that you're in and watch how bad your doctor is when you're looking at the interactions. You're like, oh, this one's severe. This one's moderate. This one's mild. Right? Or it's like, oh, I had a patient or a doctor, that reached out to me and was like, hey, my patient's taking these medications. I plugged it into drugs.com. They were on like 16 meds. It's like, there's no way there's not a cross reaction between these two. And sure enough, came back and was like, you're not supposed to be on this many antidepressants. You're not supposed to be on this many. You're not supposed to be on that many. Right? So you're having this compounding effect, and you have these doctors, you'll go to your specialist, you'll go to your PCPs, and none of them are communicating. They're all just sending you to the pharmacy to go get more drugs, right? And then what's that doing? It's making your body deteriorate further. So what would I suggest to do? Anybody who is worried or fearful of menopause, number one, get properly tested. Tests that I would do at the bare minimum would be an adrenal CAR, so stress profile with the CAR, cortisol awakening response. In an ideal world, we would do a full Dutch panel on you, depending on whether you have a normal cycle or not. If it's abnormal, do a cycle map. If you've got a clockwork cycle, then do just the Dutch plus. And then I would do a GI map on you. Combine the information of those two, and you'll be able to cruise so gently into menopause that you will actually physically enjoy it and feel better than you ever have. That's how you should feel in menopause. That should be what's associated with menopause, all this happiness, right? So that's what I would do. I would start there, okay? Work on getting those things tested, fixed. Know that it can take a couple years for you to correct those systems, okay? Depending on what the threat is. If you're living in a moldy environment, it can take a little bit longer depending on how quick you are to correct that environmental toxin. But for the most part, you give it a year or so, especially before you hit the menopausal age, so that your body can cruise in gently into menopause. And we can kind of alter it, do another Dutch test afterwards. See how your hormones look after you get into menopause. Okay. Other things you could do here too. Okay. This stuff is super duper duper easy. Number one, get to sleep on time. Okay. So again, 10 p.m., 6 a.m., sleep, wake every single night. I do not care if you're like, well, I still get my 7 or 8 hours. I just go to bed at midnight or 1 o'clock. Doesn't matter. It's not healthy for you. Stop it. All right. That's why there's a higher correlation with night shift workers and cancer. I think there's like an 80% increased risk. Don't hold me exactly to that, but I do know that there's a huge increased risk of cancer for night shift workers, night nurses, etc. Not healthy for you for that reason. What else? Make sure you sleep the entire night through. Okay. This goes for men and women. If you're waking up in the middle of the night, that means your cortisol is outproducing your melatonin in those instances, or you're toxic. You're getting up, using the restroom, getting back to bed. That is not a full night's sleep. It is interrupted. It's not healthy sleep. Make sure you improve that and find out why. Even if you don't have trouble going back to sleep, it's still the same thing, even if you're zombie walking. Okay. For the stress side of things, make sure you have open, honest communication with your spouse. Right? Hey, I'm fearful of blah, blah, blah. What if I blah, blah, blah? You should have, especially if you've been together for a long time, you should have a badass support system with your spouse. If you don't, then it's not exactly the healthiest relationship. It's up to you if you want to keep choosing that route, but you should be able to communicate with your spouse about what you're going through, what fears you might have. And if they're doing something to piss you off, you should also be able to check them on that. So that way you can get it fixed so that there's no underlying stresses. Because what I see so often is these wives, these moms are busting their ass all day long. They never get any sense of like, you did a fantastic fucking job. Then they go to sleep ignored or stressed. Then their spouse wants to have sex with them. They're not in the mood because they're stressed from the day of. Then the spouse gets mad at them and then they go to sleep. That's a common pattern that I see. It's nothing that I would ever want myself to experience with my wife. Hell no. No way. That's not an acceptable relationship. Right? So if we can work on correcting some of these things, start openly speaking, start setting boundaries with our spouses, like, hey, you won't talk to me like that, or with friends, family members, hey, this is what my requirements are for us to have a good communication or a good connection. If you're not willing to do that, then I'm not willing to have you in my life at this time. Or if so, I'm going to have you in as an as-needed basis because I'm just not willing to sacrifice my health to have you in my life. Okay, these are just some random things you can do. And this isn't something where I'm like, hey, you guys should take this supplement, or hey, you guys should take this herb, or hey, you should take this. Or I'm not here to plug and chug supplements at you. I'm here to try to help you address some lifestyle stuff first, get some proper testing done, and see if you are deficient in some of those nutrients, or see if you are having hormonal imbalances or gut infections that are causing your hormones to be imbalanced to begin with. That being said, hopefully this little route of menopause is beneficial to you. I want you to know that you don't have to dread going into menopause. Not everybody deals with menopausitis. Okay, you choose whether you want to have menopausitis or not. It is not hereditary. It is not genetic. It is not just because you're getting older. The only thing that age has to do with it is years of neglect on your body. Start correcting this stuff now. Start learning how to balance your hormones now. So that way, when you do hit menopause, it is awesome, it is amazing, and you can go around spreading the good news that menopause doesn't have to be terrible. That being said, I'm out. Have a great day. Love you guys. Thanks for tuning in, as always.